Folder 8 Independent Review. During middle childhood, children gain a little more than 2 inches a year in height and add around 5 to 7 pounds to their weight every year. In general, children become more slender during this time. Individual variation tends to increase with the age of the child. Boys are slightly taller and heavier than girls until around 9 or 10 years of age, when girls on average begin their own adolescent growth spurt, a period of rapid change in height and weight. Girls then surpass boys until around age 13 or 14, when boys are reaching the peak of their own growth spurt. Boys and girls also develop increased muscular strength during middle childhood. While the ratio of muscle to fatty tissue is about the same for the sexes in early middle childhood, boys develop proportionally more muscles beginning at about age 7. Since children are growing regularly and expending a lot of energy, they need an average of about 2,000 calories a day when they are 7 to 10 years of age. Sometimes, though, children develop obesity, an excessive amount of body fat. One definition of obesity is a body weight that is 20% above the norm for a specific weight. Using this criterion, approximately 25% of children in Canada are obese. The incidence of obesity has increased in spite of society's emphasis on health and fitness in all races. During the past generation, obesity increased by more than 50% for children 6 to 11 years of age and by about 40% for children who are 12 to 17 years of age. Most overweight children do not outgrow their weight problem. Rather, most children who are overweight become overweight adults, whereas a smaller proportion, 40% of boys and 20% of girls, of normal weight children become obese as adults. Children who are obese are more likely to be rejected by peers and, as they enter adolescence, become even less popular. Adolescents who are overweight are more likely than their normal weight peers to be anxious and depressed. Some children who are obese develop high blood pressure. High blood pressure in children can lead to damage to the heart, kidneys, and even the eyes. Pediatrics published guidelines for doctors to check blood pressure even in 3-year-old children. While changes in lifestyle to reduce blood pressure are preferable, some children may need to be placed on medication to treat elevated blood pressure. Genetic factors likely have a role in obesity. Heredity may also play a role in how quickly the body burns extra calories versus turning them into fat. Genetic factors may also affect the amount of adipose tissue, or fat cells, individuals have. Children who have more fat cells may feel hungry sooner than those with fewer fat cells. One study supporting genetic factors found that identical twins tended to have the same body weight as adults, regardless of whether they had been reared separately or together. Environmental factors also may play a role in obesity. One longitudinal study reported that children during the middle years who watched at least 25 hours of television a week were more likely to be obese in adolescence. Children who watch more television may get less exercise and consume more snacks. And since TV programming advertises high-caloric foods, these snacks may be things like potato chips and candy. Children see about 10,000 food commercials per year, with a majority of these commercials being for fast food, candy, cereal, or soft drinks. Stresses in children's lives, such as divorce or conflict in the home, may also contribute to overeating. Children continue to improve motor skills during middle childhood and usually like to join games and activities that use large muscles such as playing catch. Maturation contributes to this development, with neurons becoming more myelinated and muscles becoming stronger. Children's experiences are also very important in developing these abilities, although there are hereditary factors that contribute to individual differences as well. Reaction time, or time needed to respond to stimuli, is a basic skill affecting performance in activities, such as batting a ball or avoiding obstacles when riding a bike. Reaction time improves or decreases during childhood until about 18 years of age. During adulthood, reaction time increases or gets worse, but older adults usually still outperform children. Fine motor skills such as buttoning clothes improve during childhood as well. During middle childhood, boys have a slight edge in overall strength and in forearm strength, which helps with batting or throwing balls. Girls, though, have greater flexibility and limb coordination, which aids such sports as gymnastics. Gender differences become greater at puberty and favors boys. Before puberty, boys may be more likely to be encouraged to participate in sports and boys may be more involved than girls in competitive games in middle childhood. Pubertal increases in size and strength may give boys a biological advantage at that time, but environmental factors may also contribute to play a role. Exercise conveys both health and psychological benefits to children and adults. However, the Canadian Pediatric Society reports that most schools offer half of the recommended provincial requirements for physical education. Only 38% of acceptable weight children and 30% of overweight children are physically active. Increased television viewing may contribute to a decline in fitness. Also, the sports emphasized by school, such as baseball and football, may be less likely to promote fitness than bicycling, swimming laps, or jogging. Parents can encourage physical fitness in their children by reducing time in front of the TV, encouraging outdoor play, and finding time for family physical activities. Pushing children too hard or too early towards excelling in team sports may lead to frustration or injury, and they are becoming less likely to become involved in physical activities later in life. Some disabilities are likely to be noticed during middle childhood when a child is required to sit still in school and learn specific academic skills. Attention deficit hyperactivity disorder, characterized by the child's lack of attention, impulsiveness, and excessive movement or hyperactivity, is one disability that can interfere with school performance. These characteristics apply to some extent to many children, so careful diagnosis is important, using criteria given by the American Psychiatric Association. From 1 to 5% of children in schools are diagnosed with ADHD, with boys being many times more likely than girls to be given this diagnosis. ADHD tends to recur repeatedly in a family, providing some support for physical causes. ADHD occurs alongside other psychological disorders, including depression and anxiety. ADHD is more common in children who have had encephalitis, and brainwave frequency recordings are more likely to indicate abnormalities. For some children, an inherited defect in the thyroid hormone system may be a factor. Some have hypothesized that chemical additives in food contribute to hyperactivity. However, studies with children on the Feingold diet, which removes food additives, have not provided support for this position. NIG argue that inhibitory processes related to the executive control may be involved. In other words, children with ADHD have difficulty controlling and inhibiting their responses. Cognitive behavioral therapy has also shown promise in the treatment of ADHD. Teaching children to stop and think may help them gain self-control. However, a recent study found that medication with stimulants was more effective than cognitive behavioral therapy. Many children seem to outgrow ADHD. However, some longitudinal studies have found that 2/3 of the children diagnosed with ADHD continue to experience at least one symptom in adolescence and adulthood. Stimulants, drugs that increase the nervous system's activity, such as Ritalin, are the most common treatment for ADHD in children. This may seem paradoxical since these children are already overactive. These drugs, though, block the reabsorption of two of the brain's neurotransmitters, which helps to inhibit and provide control over more primitive areas in the brain. Stimulants found in coffee, cola, and chocolate also seem to help children control their behavior. Stimulants help children increase their attention span and improve their academic performance. Critics, though, have argued that stimulants may suppress height and cause weight gain, and may not be as effective after a period of time. Academic performance can also be affected by learning disabilities, disorders that involve problems in developing specific language, speech, or academic skills. Dyslexia, a learning disorder affecting reading that involves reversing letters, reduced comprehension, and slower reading, is one example. If children perform below the expected level for their age and intelligence, especially when other handicaps such as sensory problems or disadvantaged environments are not present, a learning disability is frequently considered responsible for this discrepancy. Other problems such as ADHD or emotional problems often accompany learning disorders. Most learning disorders persist throughout an individual's life. However, recognizing the problem early and providing appropriate remediation can help the individual overcome related problems. Dyslexia affects between 5 and 17.5% of children, occurring more commonly in boys. Remediation for dyslexia includes exercises that teach children blending of sounds. Accommodation, such as allowing extra time to complete tasks, may be the focus as a child grows older. Current explanations for dyslexia focus on possible neurological problems. These neurological problems may be inherited since dyslexia tends to run in families. According to various estimates, 25 to 65% of dyslexic children also have a dyslexic parent. The neurological problems may be related to faulty wiring in the brain's left hemisphere, specifically in the angular gyrus, an area believed to translate visual written words into auditory sound information. High levels of prenatal testosterone secreted by the fetal testes may contribute to slower growth of the left hemisphere and may be a reason why males are more likely than females to be dyslexic. Children with a variety of disabilities, including emotional disturbance, learning disabilities, physical disabilities, and mild mental retardation, have received special educational programming. A question that is debated is whether it is best to place these children in special classes or use mainstreaming, which involves placing children with disabilities in regular classrooms with adaptations for their needs. If children are placed in special needs classes, they may be stigmatized by being segregated from other children. Also, teachers as well as the students themselves may have low expectations for children in these classes, expectations that become a self-fulfilling prophecy. However, mainstreaming can lead to problems for children with learning disabilities, particularly for lower performing students. A regular classroom environment can be overwhelming. What kinds of teaching techniques help children with learning disabilities? One study of 91 students with certified learning disabilities found that instruction in theme identification helped them more than a traditional instruction technique. Helping children recognize themes in stories may facilitate more abstract thinking in children with learning disabilities.